start.
This meeting is being recorded.
Okay. Yes. Continue.
Thank you. One day, last Sunday, my friend came to me when I was in the park, beautiful flowers were there. Then I was moving around. Suddenly, my friend came. He was walking along with me. Then it was something I could see. The face was a little bit, some sort of challenge. I asked him what happened. He was telling, I went to medical checkup, just casual checkup. Then they told me that diabetic and BP are in the border range. So doctors cautioned about it. And they told that my father was having BP and diabetes. He's using the medication. Now, I was worried that, I will have the same challenge like that. I told, don't worry. Let us meet our Guruji. He will give us a lot of information, how to maintain good health. We both went to that Guruji. Then doctor asked a few questions. See, some people are taking the medication. Whenever they take the medication for the diabetic or sugar, is the medicine is getting stopped after some time? No. Then why they are taking the medication then? First they start with half tablet, then 1 tablet, then 2 tablets. Then doses are getting increased. Then why it is medicine? That's the reason doctors say you should take lifelong, because this is not a disease at all. Hello friends, this is Blissful Brahma. Welcome to my presentation on sugar and BP are not diabetes. I will give you the information to the presentation.
Yeah, Brahmanji, 2 minutes. Swati, if you could just translate this much the story.
हाँ, ब्रह्मन जी का कहना है कि एक बार हम जब शुरू करते हैं बीपी और डायबिटीज का मेडिसिन, सो इट नेवर स्टॉप्स. तो ऐसी चीज जो कभी रुकती नहीं है, कैन दैट बी अ सॉल्यूशन?
it can't be a solution. आप दवाई लेते हो बंद होने के लिए, आप दवाई लेते हो बंद होने के लिए, पर आप जब ये बीपी और शुगर का जब आप दवाई लेते हो, ये तो बंद ही नहीं होता, ये तो बढ़ता जाता है. पहले आप हाफ टैबलेट से शुरू करते हो, फिर आप पूरा टैबलेट लेते हो, फिर उसके बाद फिर आपका इंजेक्शन भी शुरू हो जाता है. तो फिर क्या फायदा क्या है इस चीज का? सो टुडे इसी चीज से
डॉक्टर बार बार बोल देते हैं कभी मत बंद कीजिए इनको, हमसे पूछे बिना कभी मत बंद कीजिए इनको. यू मस्ट.
आज हम सुनेंगे ब्रह्मन जी से कि क्या है इस बारे में, वो क्या कहना चाहते हैं. लेट अस हियर फ्रॉम यू. ओवर टू यू ब्रह्मन.
I am not able to share the screen. Can you help me to share the screen?
Yeah, hold on. I'll just check your presentation. 1 minute. I'll give you. Wait, I'll make you co-host. No, 1 minute.
Yes, I got it. Yes.
Got it? Okay.
Yeah.
मैंने उनको co-host बना दिया.
हाँ, ठीक है.
So Brahman ji, do you practice online as well?
Yes.
Okay. You do consult.
Brahmanji, please unmute yourself, and Swati, please unmute yourself.
Yeah. Sugar and BP are not diseases.
So I was asking Brahman ji, do you practice online as well?
Yeah, madam, end of the session we'll ask Q&A, madam, question and answers.
Okay, fine.
This is Blissful Brahma, wellness coach. What is sugar disease? Or it is diabetes. Our body is made up of trillions of cells. It is also has several million kilometers long blood veins. The nutrients in the food we eat get digested in the small intestine and they mix in the blood through the liver. Then what is good sugar and bad sugar? Let us see. Whenever we take the food is converted to the sugar. What is good or bad? Let us see. Okay. Now, whenever we eat good nutrition food and properly digested, then it becomes a good sugar. Then what is bad sugar? Sometimes, whenever we eat, how do we eat? Open the mouth and eat like that. Sometimes we take water along with the food. During this time, the food gets spoiled in the mouth or in the stomach also. That time, bad sugar is formed. Whenever the bad sugar eaten by the cells get damaged. But luckily, God has given pancreatic gland to check the blood good or bad. So the pancreatic gland will check sugar good or bad. If it is good, stamp with insulin. If it is bad sugar, no, you are not good. I will not stamp. Why? If the cells eaten that bad sugar, the cells will damage. Now, question to you, that bad sugar should remain in the body or should go out? It should go out. How it will go out? That good sugar eaten by the cells get energy and cells will send the waste out of the body. So we need to have a good sugar. Whenever we take the tablets, what happens? Pancreatic gland is not having sufficient insulin. So we are trying to instruct that you give insulin. So pancreatic gland will give the insulin to the bad sugar whenever we take the tablets. That time, what happens? Cells will eat the bad sugar, cells get damaged, and pancreatic gland also cells, right? Entire body is all the cells. So pancreas gland also cell. After some time, pancreas gland also will not work. Slowly, that insulin stops producing. Then people will go for injection. Are you able to understand?
We will explain it in Hindi.
Yes, please. Yes, please.
Yeah. Swati, will you?
ब्रह्मन जी का कहना है we have two types of sugar in our blood. One is the good sugar and the bad sugar. Bad sugar का बहुत जरूरी है वो हमारे शरीर से निकल जाए. अगर वो नहीं निकलते हैं तो वो सारे सेल्स को खराब कर देंगे हमारे बॉडी के अंदर. और पैनक्रियास ग्लैंड रिड्यूसेस बैड शुगर. अगर हमारा पैनक्रियास जो ऑर्गन है बॉडी में वो अगर अच्छे से फंक्शन कर रहा है तो वो मदद करता है हमारे शरीर को बैड शुगर को निकालने के लिए बॉडी से. और अगर बैड शुगर नहीं निकला तो धीमे धीमे हमें टैबलेट से भी काम नहीं चलता है, हमें इंसुलिन इंजेक्शन लेना पड़ता है. ओके, इज इट ओके?
यस. द पैनक्रियाटिक ग्लैंड जो है वो इंसुलिन से बैड शुगर को निकालता है. एंड हम क्या करते हैं, हम जब दवाई लेते हैं तो हम लोग पैनक्रियास को हम लोग इंस्ट्रक्ट करते हैं कि आप इंसुलिन प्रोड्यूस करो. वो नेचुरली इंसुलिन प्रोड्यूस करना बंद कर देता है, तो हम उसको इंस्ट्रक्ट करते हैं कि आप अभी इंसुलिन प्रोड्यूस करना शुरू कर दो. अब जब हम ये दवाई लेते हैं और जब पैनक्रियास जब आर्टिफिशियली जब इंसुलिन प्रोड्यूस करना शुरू कर देता है, तब जाके ये जो इंसुलिन जो आर्टिफिशियली जो होता है ये जाके बैड शुगर को खाता है. और जब बैड शुगर खाता है तब ये बैड शुगर जाके आगे जाके ये सब सेल्स को खराब करता है. और ये इंसुलिन की मात्रा भी जैसे जैसे कम होती है तो हमें इंजेक्शन लेना पड़ता है ये इंसुलिन की मात्रा को और भी बढ़ाने के लिए. यस, ओवर टू यू ब्रह्मन जी.
Thank you. So we need to stop the bad sugar with the proper eating and water consumption. Proper eating means whenever we eat, we should chew the food properly. It means close the mouth, close your eyes, chewing almost 30 to 40 times chewing. Then the half of the digestion will happen in the mouth itself. And water consumption. We should not drink water while eating the food. Maybe little bit sip is okay for drinking purpose. Otherwise, if you are thirsty only, you can take. Otherwise, we should not take water during the food. Reason is that whenever the air goes into the mouth, that food is spoiled in the mouth. Similarly, while eating the food, whenever we take water, the water also will spoil the food. Because of the bad digestion, bad sugar forms. So we should stop bad sugar. We should take the balanced nutrition food. Because, whenever what we take, idli, vada, dosa, vada pav and all, if you take, what happens? Mostly carbohydrates. We need to have the good nutrition food. That food should contain not only carbohydrates, should contain proteins, should contain fats, it should contain vitamins and minerals, it should contain fiber also. Yeah, this is what one slide.
Yeah, so I'll just explain the slide. Swati, will you?
हाँ हाँ, नहीं नहीं, ये हम सबको पता ही है that balanced food लेना चाहिए हमेशा. We should not depend only on carbohydrates, which is mainly chapatis and rice, या फिर proteins. कुछ लोग वजन घटाने के लिए बहुत ज्यादा प्रोटीन कंज्यूम करते हैं. For non-vegetarians, chicken and meat is a major source of protein. Otherwise, एक keto diet का fashion है अभी, तो उसमें लोग खाली fats consume करते हैं. So we should always have a balanced diet. ब्रह्मन जी का कहना है जिसमें कार्बोहाइड्रेट, प्रोटीन, फैट्स और मिनरल्स as well as fiber, most important, सब कुछ होना चाहिए. और एक जो सबसे जरूरी बात बताई उन्होंने, जो कि बेसिक है बिल्कुल लाइफस्टाइल का, कभी भी खाना खाते समय पानी नहीं पीना चाहिए. Am I right, Mr. Brahman?
Yes, madam. Yes, madam.
Yes. थोड़ा बहुत बहुत प्यास लगी तो थोड़ा हम सिप कर सकते हैं, बट हमेशा खाना खाने के हाफ एन आवर पहले और हाफ एन आवर बाद हमें पानी नहीं लेना.
While eating also.
Yes. खाना खाते वक्त कभी बीच में पानी नहीं पीना चाहिए. Okay.
My internet was unstable, so I'm trying to close couple of things. Yeah, can you hear me?
Yeah.
Yes, clear.
Yeah. Now, how the carbo-based breakfast, it will, what happens when you take the carbohydrates-based breakfast, only carbohydrates? It means, in the morning, we take like our breakfast, like idli, dosa, wheat bread, toast, vada pav, like that. Na? What happens in this case is, if you see here, the sugar, whenever we take the only carbo-based breakfast, sugar levels will go very high. Then, because of the sugar, the body generates the insulin also very high. Then, after a few hours, insulin sucks the sugar. Then we feel very, very hungry after few hours. Once again, this cycle repeats. See, this is because only if you take the carbo-based breakfast, the sugar goes beyond the normal and comes down also. This is the vicious circle, creates the challenges in our body. Maybe it really leads to diabetes, BP and extra weight also possible because of this too much variation in the sugar because of the breakfast. Yes, madam. You can, Swati madam, can you please?
Okay. So इनका कहना है ब्रह्मन जी का, हमें बहुत ज्यादा कार्बोहाइड्रेट रिच ब्रेकफास्ट नहीं करना चाहिए, जिसमें उन्होंने एग्जांपल्स दिए इडली, डोसा, इवन व्हाइट ब्रेड जो पहले बहुत चलता था, ज्यादातर लोगों ने अभी ब्राउन ब्रेड में शिफ्ट कर लिया. आई डोंट नो हाउ जेन्युइन दोज आर, बट ज्यादा कार्ब रिच ब्रेकफास्ट नहीं करना चाहिए सुबह सुबह. उससे हमें अचानक जो शुगर मिलती है तो एनर्जेटिक तो लगता है बहुत, लेकिन इमीडिएटली एनर्जी डिप भी हो जाता है बहुत जल्दी. So please tell us, Mr. Brahman, which type of breakfast should be preferred?
Yeah,
कौन सा breakfast करना चाहिए हमें?
It will come, madam. It will come next slide, madam.
Suresh ji, we will take questions. Suresh ji has raised his hand. Suresh ji will take questions at the end of the session. Thank you very much. Yeah.
Now, some people skip the breakfast, especially some while doing puja. People, especially women, morning they are busy in the kitchen, taking care of the family members, preparing the food. So whenever they skip the breakfast because of that activities, whenever they skip breakfast, see what happens. Morning, whenever they start, they can feel hunger. Sugar is very low. After that, once again, they will take brunch, breakfast, come lunch. They will have once again carb-based breakfast. Sugar levels goes high. Because of sugar goes high, insulin is produced. Insulin will suck the sugar. Extra fat will be converted. Then once again, it will have the low sugar once again. Once again, this cycle repeats. This also causes the problem of the blood pressure, diabetes, BP, and extra weight. Reason is vicious cycle of up and downs. Some people also, to lose weight, they skip the one food. That creates a problem. This is actually skipping the breakfast challenges. Swati madam, so Dr. Sahika madam, can you please?
Swati.
Yeah, इसमें Brahman ji that we should not skip our breakfast, isn't it?
Yes,
पहली बात तो कार्बोहाइड्रेट रिच ब्रेकफास्ट नहीं लेना चाहिए और दूसरी बात बिल्कुल स्किप नहीं करना चाहिए ब्रेकफास्ट. दैट्स वन ऑफ द वेरी इंपॉर्टेंट मील आफ्टर अ लॉन्ग नाइट्स रेस्ट. We are feeding our body, isn't it? And before we set outside for work, we should definitely eat some home cooked, घर का बना हुआ कोई भी ताजा नाश्ता करके दिन की शुरुआत करनी चाहिए. Yes.
Now we will see what is the balanced protein-based breakfast and how it helps. Okay. Whenever we take balanced protein-based breakfast, which is contains vitamins, minerals, carbohydrates, fiber, good fats, what happens is sugar levels will be within the range because this is a complex food actually. So not simple carbs. So because of the complex.
His network is
ones that since it contains throughout the day, sugar levels not go up or down also.
Okay.
Yeah, Swati.
Your voice, no, I couldn't hear most of him. Voice
yeah, I think looks like some internet connection is a little bit poor in this one. Yeah, balanced proteins-based breakfast will help to maintain good health because sugar levels is in the range.
Yes. So give us some examples like Mr. Brahman.
Yeah.
Protein-rich breakfast.
Yeah, any nutrition food which contains proper balanced one like carbohydrates, some 40%, fats 30%, proteins 30%, with including fiber, all are balanced one. Whatever the body needs of vitamins and minerals, all are supplied. Then body sugar levels will not go high or low also. We will have good maintain. That appetite for the junk food will be stopped. Then you can maintain good health with this.
और स्पेशली आपने लिखा है मिस्टर ब्रह्मन दैट शुगर रिच फूड कुछ नहीं खाना चाहिए. स्नैक्स, चॉकलेट, पेस्ट्रीज, ऑल ऑफ देम आर लोडेड विद शुगर, इजंट इट? दे विल गिव बहुत अचानक किक देंगे एंड अ रश ऑफ एनर्जी इनटू अस, बट अगेन देयर विल बी अ डिप. उतनी जल्दी हम डी एनर्जाइज्ड भी हो जाएंगे. सो हमेशा बैलेंस्ड, न्यूट्रिशनली बैलेंस्ड ब्रेकफास्ट करना है. ठीक है?
Yes, madam. Now we'll come back to the blood pressure. Just think blood as a train, as a railway station.
Okay.
So whenever the train goes to each and every railway station, there is a body part. Some people get into the train, some people get out. Similarly, In the blood also, whenever it reaches the organ, some items get into the blood, some items will get out of the blood.
Okay.
Yeah, so you can explain this in Hindi. Yeah, blood.
हाँ, तो बहुत अच्छा एक तुलना किया है हमारे बॉडी को उन्होंने इसके ट्रेन के साथ. सो ट्रेन एक ब्लड हमारे बॉडी में जो पूरा फ्लो करता है, सपोज दैट्स द ट्रेन, और उसमें ईच बॉडी पार्ट इज अ रेलवे स्टेशन. एम आई राइट?
Yes, madam. Yes, madam.
ओके.
तो जब एक बॉडी पार्ट तक जाता है तो उस बॉडी पार्ट से ट्रेन ब्लड कुछ लेता है और कुछ छोड़ता है. जैसे एक ट्रेन कोई रेलवे स्टेशन में जाने से कुछ लोग उतरते हैं और कुछ लोग चढ़ते हैं, वैसे ही कुछ न्यूट्रिशन ब्लड वो बॉडी पार्ट से लेता है और कुछ न्यूट्रिशन वो बॉडी पार्ट से छोड़ता है.
Yes,
over to you.
If we run fast, what happens to BP? It goes high. We'll see why. If we do meditation, what
Certainly
happens to
BP goes
BP?
low. Yes, it comes
Goes
down.
low.
Yes.
But somebody says, I am watching TV at my home. Suddenly BP has gone high. They'll ask why. Okay. Somebody says, I'm cooking food at home, but my BP is suddenly low. Why? Let us understand the reasons. Cells as a children. Think cells are children. Heart as a mother.
Okay.
Whenever cells need food or cell get disease, it asks mother food. I want food to recover myself. So what happens? Heart will supply the blood through the blood pressure. So whenever more and more cells get damaged or more exercise, if you do more exercise, that time that the cells need food. So immediately heart will try to supply more and more because of children are looking for it.
Okay.
Yeah, this is a small diagram how the body organs and the blood flow happens through the blood veins.
Yeah.
Yes, Swati madam, can you please?
Got it. तो आपने कहा कि हमारे बॉडी के सेल्स अगर बच्चों के जैसा है, हम माने उनको छोटे छोटे बच्चे, और हमारा दिल जो है वो माँ की तरह है. तो जब भी सेल्स को खाने की जरूरत पड़ती है तो वो माँ से खाना मांगते हैं, तो उसके लिए हार्ट बहुत सारा ब्लड सप्लाई करती है. ओके. आई डिडंट गेट यू आफ्टर दिस. यस.
Yeah. Heart will supply the blood through the blood pressure.
हाँ, तो खाना मांगने पर सेल्स को अचानक हार्ट बहुत सारा ब्लड सप्लाई करती है ब्लड प्रेशर के थ्रू.
Now, because of the cell's requirement, heart will supply the blood high or low. If you do meditation, cells don't need food, so BP is little low. When you run fast, walking, brisk walk, BP will be high because cells need energy, so heart will supply.
Okay. So हमारी बॉडी अपने आप एडजस्ट कर लेती है ब्लड प्रेशर, इसका मतलब है.
Yes. So BP high or low is normal, nothing to be worried.
Okay.
Now, to understand blood, how to cleanse the blood. Blood actually, it is manufactured, it is produced in the bone marrows, and it starts from the heart, goes to all over the body parts. How to cleansing the blood? One is lungs. Lungs will clean the blood to the oxygen. Next one, kidneys also will clean the blood. Third one, liver also cleans the blood. Fourth one, bone marrows also cleans the blood.
Okay.
Now, just to make you understand how the lungs are cleaning the blood. From the heart, that bad blood will go and gets oxidized once and come back. This small example I'll give. This way, blood can get purified. Swati madam, you can just tell about this.
हम हाँ, हमारे बॉडी के ब्लड बहुत ऑलमोस्ट सभी ऑर्गन्स हेल्प करते हैं ब्लड को प्यूरिफाई करने में. लंग्स जो है वो भी ब्लड प्यूरिफाई करते हैं, इवन किडनीज डू द सेम, और लिवर और बोन मैरोज बोन के अंदर जो रहता है, इवन दे हेल्प इन ब्लड को शुद्ध करने में. ठीक है, कैसे करते हैं, लंग्स का क्या रोल है वो मिस्टर ब्रह्मन समझाएंगे अभी.
Yeah, oxygen actually to have good pranayama to get oxygen. Oxygen is supplied to the blood through the lungs. Oxygen is required. Now let us understand a bit about salt. Generally, people avoid salt when BP is there. We'll see why salt is required. Salt. How much needed? Sufficient quantity of salt is needed. With not sea salt, rock salt or Himalayan salt are recommended. Now, whenever the salt is taken, whenever the salt touches the tongue, it develops the water energy. Water energy will drive the kidneys functioning properly. So, whenever kidneys are functioning properly, that the blood is purified and urine will be sent through the urinary bladder. Now, if you look at the shape, kidneys and ear are similar in shape. Now, next one is fear. The fear is another emotion. What happens? Do you remember some people wet the pants with the fear?
Yeah.
Reason is,
they pee in their pants because of fear. Yeah.
Yes, because the fear sucks the water energy.
Okay.
Because of lack of water energy, that urinary bladder cannot hold the urine. So urine comes out of the body.
Okay.
Yeah, this is what brief information. So sufficient of salt is required to maintain good health, because salt indirectly helping the kidneys perform better. Kidneys will clean the blood. So when the blood is become watery, heart will perform better. Of course, heart actually normal function, but because of blood is watery, heart will pump the more, BP will be more little bit.
Okay. Ear, what is the relation with ear, Mr. Brahman?
Ear only shape, I think some sort of relation there. I need to find out.
Okay. Okay.
And one more thing I can tell you, whenever that kidney patients and or BP patients go to hospital,
Okay.
they keep 2 saline bottles, not only 1, 2. Why? One is glucose for energy, other one is salts. There are different salts are there. Reason is because of lack of salt, some people get painted also. Salts also is going to help many ways. That's why and people got kidney problem or BP problem, lack of salt. So they keep the salt fluid also into the blood. That's why doctors say, we are giving you enough salt to the blood at present, so don't take salt more. But after some time, take sufficient quantity of salt for your taste purpose. You should take salt to maintain good health. Swati madam, can you please?
हाँ, so बॉडी में सॉल्ट की मात्रा मेंटेन करना बहुत जरूरी है. बहुत सारे फंक्शन उससे रिलेटेड है. बिल्कुल. सॉल्ट ज्यादा भी नहीं लेना चाहिए, उसी हिसाब से सॉल्ट कम भी नहीं होना चाहिए. मेरे ख्याल से वी लूज कॉन्शियसनेस if we are dehydrated and there's less salt in our body. Is it, Mr. Brahman?
Yes, madam. Yes. Salt is sufficient quantity, and it should have rock salt or Himalayan salt.
Okay.
And वो salt लेने से जो kidney I mean then the kidney purifies the blood very well, and if the kidney जब kidney जब blood को एकदम purify कर देगी तो blood पतला होगा, वो ब्लड गाढ़ा नहीं होगा, तो वो जब ब्लड पतला होगा तो वो हार्ट में जाके भी द ब्लड इज पंपिंग वेरी वेल। और उन्होंने ये भी कहा कि जब डर लगता है, जब फियर है, जब डर लगता है, तो हमें पता है जब लोगों को डर लगता है तो फिर वो सुसु करते हैं पैंट में। तो ये किस बात के लिए होता है? बिकॉज फियर, डर एक ऐसी चीज है जो किडनी को ट्रिगर करता है, और जब डर किडनी को ट्रिगर करेगा, वो किडनी से जो व्हाट इज इट फ्रॉम द किडनी, रमन जी?
Kidneys perform better.
No, in fear what happens?
Water energy comes down. Fear
अच्छा,
sucks the
ओके
water energy.
ओके ओके। तो जब डर होता है तब वो पानी जो है किडनी से कम हो जाता है और ये पकड़ नहीं पाता, इसलिए बॉडी पानी छोड़ देता है। तो ये डर के साथ, इसीलिए वो बोलते कि डर से इसने सुसु कर दिया। वही बात है कि डर भी, इट इज ऑल्सो वेरी नेगेटिव इमोशन फॉर द बॉडी टू गिव आउट फ्लूइड्स।
Yes, thank you, madam. In summary, we need to have good sugar to send the bad sugar out and energy to the cells. Good quality bread is required, that can be with balanced nutrition food. Oxygen is required to clean the blood, so we need to do the pranayama, yoga to maintain good health. Vitamins and minerals are required to cure the cells disease. Sufficient salt for water energy required to improve the kidney functionality. Be courageous. If any challenge is there, be courageous. So you can check all right. If you look at here, whenever we have got a BP, what we need to do, we need to have the lifestyle correction, like a small pranayama exercises, then good nutrition. These two things will help. That's the reason doctors will say no medicine you should take lifelong. But basically, if we start taking the good nutrition and the correction lifestyle, slowly BP and sugar will be normal. Medicine can be stopped slowly. I used to help 1 million families to maintain good health with nutrition by December 2025. I can't do it alone. I need your help. Thank you.
Okay.
Would you like to tell me?
Wonderful, Mr. Brahman. Yes. So
Yeah,
summary में आपने बताया है.
Share, you could stop the share, then we can go to the question answer session.
Yes,
Suresh ji,
yes.
over to you. Suresh ji, you have raised your hand since a long time. Yeah, Suresh ji. Okay, yeah, Mom Meera,
Just
please
raise
unmute
the hand,
yourself.
take something, if some button he must have pressed.
Maybe he doesn't know then how to. Okay, yeah, fine, okay.
Yeah, many people, they eat sweets, you know. What is the after effect after eating so much of sweets? That's what I ask.
Whenever sugar is taken, that sweets.
Yeah, in form of rasgulla or barfi or whatever.
Yeah.
Yeah.
That is actually carbohydrates only. So that contains basically sugar and so carbohydrates. So immediately our body tended to supply the more insulin. Then if it is not digested properly, then once again it's converted to bad sugar. When bad sugar converted, you can see all other challenges. So sweet is required sufficient, not too much, not too less also.
Okay.
Yes, गुलाब जी बोलिए. आप अनम्यूट करिए अपने आप को. गुलाब जी, आप अनम्यूट करिए अपने आप को प्लीज.
मैं बोलूं? मैं कुछ बोलूं?
बोलिए ना, बोलिए बोलिए.
हाँ, दिलीप जी बोलिए.
या ब्रह्मन जी, आप बोले, आप गुड शुगर और बैड शुगर के बारे में बोले.
He knows English, he doesn't understand Hindi, Dilip.
थोड़ा मालूम है मैडम, थोड़ा.
Okay, that you are telling about good and bad sugar. So what are the good sugar and what are the bad sugar? You were just telling every time.
Yeah.
So what is the good sugar and bad sugar?
Yes. To understand good sugar, bad sugar, first we need to understand what the digestion process. whenever we take the food, it is digested. First it goes to the stomach, then it goes to the small intestines, and after that to the liver also. So if all are working properly, if you are taking the proper good food, all our organs are working properly, you are taking the correct way of chewing the things, it forms the sugar actually, sugar. But the sugar will be eaten by the cells, cells also get energy. That is a normal way. But generally what happens, while eating, no, we'll like that we try to eat. In that process, what happens, na, air goes inside the mouth. So the food is spoiled in the mouth itself. If you see, sometimes no, we get vomiting, right? Sometimes even that while chewing the food, you spit out and see on the palm. What happens? We don't like to eat it back because of the exposure to air, the food is spoiled. So whenever the spoiled food because of air in the mouth, water in the stomach, that food will get digested a different way. That forms the bad sugar. Only forming of the sugar, that's all. So whenever the bad sugar is formed, that pancreatic gland will not work.
That means this sugar which is could not be digested, that is a bad sugar, isn't
yes,
it?
yeah, right. Yes, yes.
Thank you very much.
Yes, Gulab ji.
जी शुगर के पेशेंट मिल्क और फ्रूट कौन ले सकते हैं क्या?
Milk and fruit. Can sugar patients take milk and fruit?
Yes, fruits are taken, but milk actually, it is not good for digestion. Milk will, actually what happens is, if you take the milk, na, it forms the coating on the intestines. So over the period of time, that milk gives the challenges to the digestion. But otherwise, we can take. Because,
can I ask a question?
See, fruits actually,
What?
good carbs definitely. So good carbs required. But you know, sometimes banana or some high sugary things, we take little quantity, but not too much quantity.
क्या उपवास कर सकते हैं?
Can they fast?
Fasting is very good actually. Once in a week or sometime, even first Saturday, one day night, only one meal, skip it. So that see the night actually, whenever the fasting happens, night, no, body taking the rest. Whenever the body taking rest, all organs work properly. Every organ is required to have good rest. So once in a while, weekly once, night, one meal, skip it and see the amazing results.
Okay.
Fasting definitely helps.
Thank you.
Yes, Ganguly.
Can I ask a question, please?
Yeah, please.
I want to know what is the correct way of drinking water, because there are some people who have the habit of drinking water that they carry a bottle while walking, they drink sip by sip, and some people drink at once a full glass of water. So what is the correct way of drinking water?
It depends on the situation. Let us say we are traveling on public transport, so there will not be restrooms immediately. So body needs water. Then we should sip small sips. We should take, because whenever we take the small sips water goes to the body. You just get hydrated, but it not go to urinary bladder. It not go. But if you take at suddenly 1 liter water, within half an hour you can get the urine also. So if you want morning before food, empty stomach or early morning, you can take half liter to 1 liter water, which will clean the body and waste urine also will out. So depends on the situation. You should take small sips or more water.
Thank you.
Thank you.
Is anyone else? Any other questions? Any other questions? तो बेसिकली ब्रह्मन जी यही कहना चाहते हैं कि डायबिटीज एंड ब्लड प्रेशर ये रोग नहीं है, ये रोग नहीं है और एक्चुअली मेडिसिन की जरूरत नहीं है। हम अगर लाइफस्टाइल में थोड़ा सा करेक्शन, उन्होंने यही वर्ड यूज किया कि करेक्शन, इट्स अ लाइफस्टाइल करेक्शन, ये एक लाइफस्टाइल डिजीज है। तो हम अगर करेक्शन थोड़ा सा कर ले, इफ वी हैव अ बैलेंस डाइट, कुछ कम नहीं हो कुछ ज्यादा नहीं हो, और हम अगर मात्रा में खाए, और इफ वी हैव अ गुड ब्रेकफास्ट, गुड लंच एंड अ गुड डिनर, थोड़ा सा फास्टिंग हो जाए बॉडी में, सो अगर ये सब अगर हम अच्छे से मेंटेन करेंगे, then we can certainly have a good lifestyle without diabetes or without blood sugar, because these are only, but क्योंकि इसमें अगर आप एक बार दवाई खाना शुरू कर दो, then you are stopping your body from producing its own way of working. बॉडी काम करना बंद कर देगा आप अगर दवाई लोगे, तो जितना कम हो सकता है आप दवाई कम लीजिए, और डिपेंड ऑन योर ओन बॉडी टू फंक्शन वेल एंड take care of the blood pressure and the sugar level of the blood. Anything else you would like to add, Brahmanji?
That's correct, madam. Thank you, madam. That's nice.
Any other questions, Madhumita?
Now, Brahmanji, wanted to ask, these two, I would not call diseases anymore. These two lifestyle, what you would say, these are kind of our everyday
irregularities. It is a lifestyle irregularity.
Maybe,
Yeah.
yes. How? I think another thing we need to add to this is the sleep. How important sleep is, isn't it? For everything, we are connected. The sleep, 8 hours of sleep is very important for even our blood pressure, even our everything. Everything is connected to the sleep pattern, isn't it? What
Yes,
would you
madam.
say?
Sleep is very much important, especially 6 to 8 hours of sleep is required. During the sleep, body cleanses itself. In fact, if you see, morning, after getting up, during the sleep itself, while the body is cleaning, body develops so many enzymes to cure the diseases, to get it. In the sense, especially in the mouth, saliva, which is very good for health actually. Urine and saliva both are the ones which is body develops more quantity to cook itself. Up in the morning, after getting up, if you can drink the water, brushing, the saliva goes into the body, and it does the wonders. It cleanses it. It does the magic actually. And apart from that, in the morning, the saliva you put little bit and put into the eyes. That some people know in the old age we get cataract. That cataract can be stopped also because of the saliva. Saliva, if daily try to put into the eyes little bit, then that cataract can be stopped.
Early morning saliva. Early morning
Yes,
saliva.
Without before brushing our teeth.
Before
yes.
brushing our teeth. Yeah.
Okay, great.
Before drinking water also?
Yeah, drinking water, that saliva goes into the body, and the body does wonders. Get the cleaning and all medicines go into the body actually. Yes.
Because normally what we do is we get up in the morning and we remove that good saliva in the mouth by brushing our teeth. But that is not the case. He says that saliva should be consumed. The saliva which is produced overnight should be consumed. Because that saliva does wonders to the gut. And that same saliva, the early morning saliva, if we use it to the eyes, it takes care of cataract.
Yes, madam. Thank you. Yes.
Thank you.
In fact, मैं इनके बारे में sleep और ये saliva के बारे में पढ़ रही थी. ये जो brushing और the concept is come from the West.
From the West, yes.
Toothpaste, to sell toothpaste has sugar, और वो हम sugar मुंह में डालते हैं, हमको sugar rush होता है, we feel good, and they add mint, so we feel fresh. All these are marketing gimmicks which we have become a habit of our life, so we don't leave. We are continuing with the habit. So
but there's another,
they have left, the Britishers have left these practices with us.
Yes, correct.
But there's another practice which we say bed and breakfast. I mean, breakfast on the bed. So that's a good one.
That's a good one. We eat without brushing. Correct.
Absolutely.
Yes, Dilipji, yes.
Okay. Yeah. I just want to know from Mr. Brahmanji, whenever we visit a doctor for a normal checkup, they just put this meter, barometer, and they say that, oh, your blood pressure is very high, so you take these medicines. Okay. Well, I want to say suppose 160, my BP is high is 160, dead. Then doctor says 160, it should be 120. So he prescribes medicine. So you just tell me, what is the actually thumb rule of BP and diabetes also? That I don't want to know. Or
I think BP 120/80 is normal, and little bit more also okay. But beyond that, no, some cells need more food. That's why heart is pumping more. So we need to identify what are the challenges body is. See, BP is coming because of BP is more because of some cells got damaged or some cells need food. So we need to identify the cells damages. Maybe some other challenge might be there in the body, which we need to identify. So otherwise, BP little bit high is no problem. If it is continuously high, like example, no, somebody is watching TV, suddenly BP high, somebody is cooking food, suddenly low. That is actually some challenge into the body. Not the BP is not a disease. Blood pressure low or high is possible because of some cells, some challenge. So we need to identify that one.
And diabetes, for diabetes.
I think sugar levels, I think everybody knows what some range, there is a range. So sugar goes high whenever there is a bad sugar is more. It should be there in the blood, no doubt about it. It should not be consumed by the cells, but it should be sent out of the body. How to send out of the body? We need to have the good to send the bad sugar out.
Okay, thank you.
And actually, these limits also, Dilipji, they are with culture to culture, they differ. From place to place, culture to culture, they differ. Like places which are very, very hot there, you know, then the blood pressure is different. In India, the blood pressure levels are different. In cold countries, the blood pressure levels are different. So these are all very dynamic. Very, very dynamic. So we can't go with just one level of sugar or one level of one thumb rule. The thumb rule is not the same. The thumb rule is different. Even in India, the thumb rule would be different. In extreme north, in Kashmir, it would be different. In Kanyakumari, it would be different, you know, because then the weather conditions are very different. The nutrition factors are very different. The lifestyle is very different. So actually, it is wrong when you say that the blood pressure should be this much and it should be this much. It actually all varies. I was reading an article the previous day. In fact, Madhumita and myself, both of us, we are doing our neuroscience, you know. So we keep reading and we keep exchanging. So while I was reading, I was seeing this, that people in different regions have different blood pressures, and different sugar levels also are required to combat that kind of weather pressure that they have. So we can't go with one thumb rule, which normally the path lab says. See, these are again gimmicks. These are all marketing gimmicks, nothing else, that take medicine so that the pharma company can benefit. We need to know our body very well. If you know your body, if it is not giving you any trouble, please just go ahead. Don't follow what the pharma company has. It's all that itna hona chahiye to fir itna hoga, aisa hoga. Sirf dara, they just put fear, psychosis, nothing else. और वो fear के वजह से हम आधा, you know, if you do pranayama, approach करो, आप अच्छे से balanced diet खाओ पियो, मुंह बंद करके चबा के खाइए खाना, सुबह उठ के वो जो सलाइवा है उसके साथ आप पानी पीजिए, everything will be normal. Just don't give in to these pharma companies and their you know, their parameters कि ये ऐसा होना चाहिए, वैसा होना चाहिए. We all human being. मेरे कपड़े आपको तो आएंगे नहीं ना, आपके कपड़े मुझे आने वाले हैं, तो हमारा पैरामीटर ही अलग है. तो फिर कैसे आपका ब्लड प्रेशर मेरे ब्लड प्रेशर के जैसे होगा, बताइए ना. It is
a well-known fact that the parameters are set by the pharmaceutical companies.
Yes, absolutely, it's set by them, you know.
How else will they sell the medicines if they don't scare us?
हाँ, exactly. If they don't scare us, उनके तो medicine बिकेंगे ही नहीं. So then this is the thing. So it is better you know your own body. अपने body को पहचानना सीखिए आप लोग कि आपको जब भी, you know, if you feel little sugar rush is less or something, you can consume a banana is good, consume a banana, something like this. So a lot of things you can find out. So this is what today Brahmanji has to say.
और सबसे जरूरी दवाई है, हर ट्यूसडे को एचएनएस सेशन अटेंड करना.
बिल्कुल बहुत मुद्दे की बात कर दी स्वाति.
बीपी और डायबिटीज दोनों कंट्रोल में रहेगा.
यस.
एक साल से कोई डॉक्टर के पास नहीं गया होगा.
Absolutely.
Let's
No
laugh.
need to go to
Let's
doctor.
laugh. Let's spend good time on every Tuesday.
Yes.
So sir, BP bhi khatam, diabetes bhi khatam.
So
Ash
this
kariye,
once in a week HNH is the best medicine for all of us.
Yes, Motwani ji, any updates from you?
Well, I really enjoy. I was listening and watching Brahmanji while I was driving, and very, very useful information. But there is some contradiction because there are many concepts now. Someone was discussing other day another session that fasting is very, very good for the health now. So if we do 16 hours, 14 hours fasting, we have to skip our breakfast for sure, sir. So what do you say about that? We recently said we should not skip our breakfast. So if we are doing fasting, we have to skip that. Then how can we maintain all these things?
Instead of skipping the breakfast, we can skip the dinner. That's what my suggestion is. So that is indirectly fasting, and from lunch to next day breakfast, we'll have almost a 16 to 20 hours gap. That's the one that will help actually. You are doing the fasting also, and the gap actually, and morning breakfast should have that balanced protein-based breakfast. Then you can maintain good health.
तो भूखे पेट सोने की आदत डालनी पड़ेगी अब तो.
हाँ.
Thank you, Amu sir. Nice session, sir.
Yes.
Thank you very much, Brahmanji, for accepting the information. The invitation at a very short notice. So we really appreciate. And next time, if you have something more interesting, also you would like to share with us, do let us know. We are happy to have you back.
Thank you.
Even the background which you are displaying, Mr. Brahman, that's so beautiful.
Amazing.
Absolutely amazing place. Thank you.
हाँ बोल दिया वो आंटी को हैंड डाउन नहीं करना आ रहा होगा मैं उनकी बात हो गई
नहीं आ रहा
Fine.
कोई बात नहीं आंटी हाँ
Okay.
Fine. Okay.
Thank you so much, everybody.
Thank you so much, everyone. We'll meet next Tuesday, and next Tuesday we will have a musical session, and Motwani ji will lead the session.
It will be Holi ke sang.
Just a request. Please. I would request everybody who wants to participate, please send me direct message so that I can prepare the script accordingly.
Yes.
And please last moment तक wait मत करिए. Last moment हम नहीं song adjust कर पाएंगे, उनका script खराब हो जाता है. So आप 3 दिन तक आपके पास time है, Sunday तक, please Sunday तक decide करिए. Isn't it? Okay.
Looking forward to the Holi session. Absolutely.
Yes.
Bye-bye, everyone.
Thank you very much, everybody. Thank you very much.
Thank you.
Remain blessed, remain healthy. Remain healthy, everybody.
Yes, very happy Women's Day to all the ladies.
Oh yes, thank you so much, Motwani ji.
Thank you so much.
Thank you.
Bye-bye.
Bye-bye. Good night.
Bye. Good night.
70. Hand raise.